In this brief presentation, I will demonstrate how the omentum, otherwise called the policeman of the abdomen, will help in arriving at the diagnosis, especially in difficult cases. Generally, when there's an incident somewhere, the police gets to the sites and maintains law and order. One of the two things they do is to cordon the area to prevent further incidents. So the omentum, also called the policeman of the abdomen, does something similar in the peripheral cavity. The omentum migrates to site of infection or trauma and helps form an adhesion around where the event is taking place, whether it's infection or inflammation, and wards it off, preventing the spread into the peritoneal cavity. So here is a case without any definitive diagnosis, presented in one of my videos. But after reviewing the last image, I realized that there is a clue from the policeman of the abdomen, and we shall see that. So you see, this is the inflamed tube. This is part of the ovary, and look at the omentum here. So what is the omentum doing here between the ovary and the tube? So this gives me a clue that the probable reason for this difficulty in diagnosis lies somewhere in the pelvis. So my focus now will be tailored more at looking at the cause of the ascites in this patient, the cause of the weight loss, and all that she presented with, for which she was empirically treated for tuberculosis. So here you can see that. Look at the thick wall of the tube here. Look at the other wall here. And look at the turbid fluid within the tube. The ovary here enlarged. Look at some peri-ovarian fluid here. And look at the omentum here. So the policeman is here. What it means is that the incident is likely to be taking place here. So you can see the tube here. Look at the omentum here. So this should be the area of focus where to look out for the primary pathology. Omentum as the policeman of the abdomen. Thank you very much for listening.